Today, I'm going to be talking about the issues that My Life, My Choice is working on, which is really an issue that is sometimes not thought of as public health, usually not thought of as public health, often thought of as a public safety issue, more than public health. But we believe it's important to clearly state this is a public health issue for a variety of different reasons. But first I want to just talk about, what it is we're talking about here. We're talking about commercial sexual exploitation of children. It's exchange of sexual activity. It's really sexual abuse for money or goods, and it's in this instance, the child is treated as a commercial and sexual object and is a victim. And so it's not a child prostitution in the sense that that's sometimes thought of. It's really about children being the victims of a crime that someone else is committing. There are not good statistics on this, though. I mean, this is not well studied in terms of our actually having a good handle on how frequent this is, what's the prevalence of commercial sex trafficking of children. But, there've been one study that was done, looked at this, estimated that across the country there were almost 300,000 children who were involved in this activity. If that is an accurate number, and we look at the fact that Massachusetts is about 2% of the overall population, that could mean that there are 6,000 children who were in Massachusetts that are being exploited through sexual trafficking. There have been other studies that have looked at whether or not children in certain kind of life situations, like when they're under the custody of child protection services, what have been the frequency of child sex exploitation, and that could be as high as 30% in some instances. When we look at homeless youth, much more likely to be seen. Just to give you a sense of the age of the young people we're talking about, mostly girls, but not only girls, also males and transgender youth. It can be as 12 to 14 is the average age when in certain studies. So we're talking about the exploitation of very young children. Why am I talking about this, and why is not the Boston Police Commissioner talking about this? And it's because I would argue that this is in fact a public health issue, and it's in part a public health issue because of the way that we think about public health. And there certainly is a part of public health where people of the general population is equally at risk. Sometimes that's true with an infectious disease like influenza, although we found even with H1N1 wasn't entirely true. But often what we find is that there are what we call social determinants of health that either put people at greater or lesser risk of premature death or of developing significant health issues. And those are health issues that include chronic disease like diabetes and asthma. We found, as I was saying before, with H1N1, we found if you were poor or a person of color, you were more likely to not only get H1N1, but be hospitalized as a result of it. And so there really is often a social determinant that is very much related to health. We also think about it from a public health perspective because there are numerous associated health concerns along with sexual trafficking. Obviously we think it's a bad thing because it's a bad thing, but it's also from a public health perspective, there are clear health concerns that result not just for the victim, but often for the larger society, and I'll get into some of the specific ones. And then a second reason is that there really are proven public health approaches that work very well and apply very well to addressing the issues involved in sexual trafficking of youth. So, just in terms of those health consequences that I was mentioning, this gives you some sense of what other associated issues. Obviously, for young people involved in sexual trafficking, it is inevitable that there's going to be a mental health issue, and it's going to be trauma, depression, anxiety in many, many instances, and that's going to have significant consequences longer term. Also, violence is very much associated with sexual trafficking. So that's violence against the victim, and that can be, again, by the person who's involving them directly in the sexual trafficking, as well as to strangers. And then the sexually transmitted diseases obviously is a significant factor, and that's everything from HIV to syphilis to gonorrhea and others. And then there are other infectious diseases that are also more likely to occur or more easily transmitted when a child is involved in sexual trafficking, and that includes things like tuberculosis and others. And then substance abuse is often an issue, and it's often it's either an issue because it's promoted by the people that are using the child in the sexual trafficking, or because it's a way of blunting the pain and the trauma that I was mentioning earlier. This is something that's known to public health folks, and we understand the way that these different health factors intersect with each other, and they aren't simply health problems for the individual themselves. They spill over and affect the rest of us. Most clearly, maybe when we think about disease transmission, that, if we have a disease transmission, we're all affected. So we really need to think about this from a societal as well as an individual, out of individual concern for the victims themselves. And then there's the public health approach. So here I would say, we kind of know some of how we would approach an issue like this. We would say the first place you start is you try to get data. You try to understand who are we talking about, how many cases, what neighborhoods, what ages, and by looking at the data, can we arrive at risk factors that would allow us to do prevention work with people by knowing that there's certain types of activities that put people at greater risk. And we also know that very often significant health problems exist, and they are missed when people seek health care. So when people go into an emergency room, let's say for a broken bone, there may be a bunch of other things going on in their lives that have contributed to the fact that they're presenting with a broken bone. But very often busy clinicians don't have the time to think about that. They treat the immediate injury in front of them. So part of, again, a public health approach is to say we need to embed in those encounters consciousness about the risk factors associated with sexual trafficking, and that it's a good idea to be screening for that, to keep that in mind as a possibility for something that you should be looking for. We also know, in public health about the importance of counseling and support, both by health professionals and by peers, in terms of helping people recover from health concerns and trauma. We know about the importance of having integrated multidisciplinary health approaches with a focus on behavioral health, not just looking at, say, an organ, but thinking about the whole person and thinking about looking, for instance, at mental health and substance abuse issues as being related to the health concerns of someone. So, I'm happy to say DPH, folks at DPH have recognized the importance of the work that's being done by My Life, My Choice and by SEEN, and that we've got a great division that focuses on violence prevention and injury prevention that's headed by Carlene Pavlos. And so over the years, we've done more joint educationals and training, and internally, we've seen the need to form at DPH a group that looks at the issues of sexual trafficking, that brings together the different separate and distinct programs at our department that might have a role in terms of awareness on this and the ability to maybe target some resources to address the issue.